This is Gina from RN2 Professors with a video for you from my OB series. I will be reviewing questions on antepartum high-risk medical conditions. In this video, I am going to review questions on antepartum high-risk medical conditions. These are conditions that were not in the other videos, including preterm labor, anemia, cardiac disorders, and hyperemesis gravidarum. I will show you how to determine what the question is asking and how to get the correct answer. Here's our first question. During an assessment of a client at 32 weeks gestation with a history of congenital ventral septal defect, a nurse notes that the client is experiencing a non-productive cough on minimal exertion. The nurse knows this assessment finding may indicate which of the following. Number 1, orthopnea. Number 2, pulmonary edema. Number 3, anemia. Number 4, decreased blood volume. This is an analysis question. The patient has a history of congenital ventral septal defect. You need to know how the patient's history relates to the signs and symptoms the patient is showing. Number 1, orthopnea. The patient would experience breathlessness while reclined with orthopnea. Sitting the patient up will relieve this condition. This is not our answer. Number 2, pulmonary edema. Non-productive cough is one of the first assessment findings in a patient with pulmonary edema. This looks like it's our answer, but let's check them all to make sure. Number 3, anemia. Fatigue would be an expected clinical manifestation in anemia, not an unproductive cough. This is not our answer. Number 4, decreased blood volume. The patient is experiencing congestive heart failure, so you would see an increase in blood volume, not a decrease. Number 2 is our answer. The cough occurs due to fluid filling the alveolar space. Here's our next question. The labor and delivery nurse reviews a client's prenatal records and notes that the client has a positive GBS culture at 27 weeks gestation. Based on current guidelines, what is the recommended plan? 1. Send a GBS culture to the laboratory immediately. 2. Prepare to administer penicillin prophylactically. 3. Determine if a follow-up culture was done at 38 weeks gestation. 4. Determine if the patient received antibiotics for positive strep. This is an analysis question. To answer this question, you need to know the guidelines for GBS testing and interventions. The question is asking what the next step is using the data that is given. Number 1, send a GBS culture to the laboratory immediately. The patient already received a positive culture at 27 weeks. Sending one now is not the appropriate action. Number 2, prepare to administer penicillin prophylactically. Giving a patient penicillin for a positive GBS is an appropriate intervention. This looks like it's our correct answer, but let's check the rest to make sure. Number 3, determine if a follow-up culture was done at 38 weeks gestation. Since the patient already tested positive at 27 weeks, they should be treated with an antibiotic. Number 4, determine if the patient received antibiotics for positive strep. Patients that test positive for GBS any time during their current pregnancy or previous pregnancies should be treated with antibiotics in the current pregnancy. Number 2 is our answer. This patient should be treated with antibiotics. Here's our next question. A client is admitted with hyperemesis gravidarum. Which of the following orders written by the primary healthcare provider is highest priority for the nurse to complete? 1. Obtain a complete blood count. 2. Check admission weight. 3. Start intravenous multivitamins. 4. Obtain urine for urinalysis. This is an analysis question. The question is asking what the biggest risk to a patient with hyperemesis gravidarum is and what is the priority treatment. Number 1. Obtain a complete blood count. The blood count is important, but it is not the highest priority for this patient. Number 2. Check admission weight. Knowing the admission weight is also important, but it is not the highest priority currently. Number 3. Start intravenous with multivitamins. A patient with hyperemesis gravidarum can become dehydrated and have multivitamin and electrolyte depletion. Giving them intravenous fluid with multivitamins is a priority intervention. This looks like it's our answer, but we will check the last one to make sure. Number 4. Obtain urine for urinalysis. Getting a urinalysis for this patient is also important, but it is not the priority. Number 3 is the answer. The patient should get IV therapy as soon as possible. The other orders can be completed after the IV is started. Here's our next question. A hospitalized gravida's blood work is hematocrit 30 and hemoglobin 10. Considering the laboratory data, which of the following meal choices should the nurse recommend? Number 1. Cheese sandwich, tossed salad, and rice pudding. Number 2. Veggie burger, cucumber salad, and wedge of cantaloupe. Number 3. Bagel with cream cheese, pear, and hearts of lettuce. Number 4. Chicken, sliced tomatoes, and dried apricots. This is an application question. You need to know what the labs are telling you about the patient, and then what the correct meal choice would be as an intervention. Number 1. Cheese sandwich, tossed salad, and rice pudding. This meal choice is high in calcium, but it will not change the patient's lab values. Number 2. Veggie burger, cucumber salad, and wedge of cantaloupe. This is a nutritious meal choice, but it will not change the patient's lab values. Number 3. Bagel with cream cheese, pear, and hearts of lettuce. This choice has high calories and hardly any nutrition. Number 4. Chicken, sliced tomatoes, and dried apricots. This meal is the highest in iron and absorbic acid. This is a great choice for a client with a low H&H. Number 4 is the correct answer. It is the only meal acceptable for a client that is anemic. Here's our final question. Which of the following pregnant clients is most high risk for preterm premature rupture of membranes? Select all that apply. Number 1. 31 weeks gestation with prolapsed mitral valve. Number 2. 32 weeks gestation with urinary tract infection. Number 3. 33 weeks gestation with twins post in vitro fertilization. Number 4. 34 weeks gestation with gestational diabetes. And number 5. 35 weeks gestation with deep vein thrombosis. This is an analysis question. To answer this question, you need to know what risk factors are for preterm premature rupture of membrane. This is also a select all that applies question, so make sure to look at each answer individually to determine if it fits the question. Number 1. 31 weeks gestation with prolapsed mitral valve. This is not a risk factor for preterm premature rupture of membranes. Number 2. 32 weeks gestation with urinary tract infection. Urinary tract infections are a risk for preterm premature rupture of membranes because they can cause chorioamnitis, which is one of the biggest causes of preterm premature rupture of membranes. This is one of our answers. Number 3. 33 weeks gestation with twins post in vitro fertilization. Having a multi-gestational pregnancy is a risk for preterm premature rupture of membranes. This is also one of our answers. Number 4. 34 weeks gestation with gestational diabetes. Gestational diabetes is not a risk factor for preterm premature rupture of membranes. Number 5. 35 weeks gestation with deep vein thrombosis. This is also not a risk for preterm premature rupture of membranes. Number 2 and number 3 are our answers. They are the only risks listed that can cause preterm premature rupture of membranes. If you like this video, please subscribe for free, drop a comment, and click the bell to get notified when new weekly videos are released. Thank you for joining me.